What if I told you there was a country in the world that spends more money per year on healthcare than any other country, yet has consistently less positive health outcomes than these countries? It's the United States of America, and according to a recent article from PBS NewsHour, spending per person per year is now up to $10,345. This is the first time healthcare spending has eclipsed $10,000 per year, and surprise, it's only going up. This increased cost of healthcare is now becoming too much for some people, prompting them to not seek medical attention until their conditions become very serious and possibly life-threatening. But haven't we heard that more people are getting insured now than ever? Actually, it's not as simple as it seems. Insurance coverage for many people does not actively meet their healthcare needs, resulting in the same lack of access to healthcare before these people got insured. Healthcare is often a topic that is discussed and debated widely in our country, but for many people, it's not well understood. Today, I hope I can help you to better understand the roots of the issues of our American healthcare system, as well as possible solutions that we can make for the future. The first issue of the system stems from the increasingly unhealthy American population and the roots of the American healthcare system as a whole. Our country is extremely unhealthy overall, which has caused health outcomes to get continuously worse. According to the NIH, or National Institute of Health, 2/3 of Americans are overweight, 1/3 of Americans are obese, 1/6 of American children are obese, and 1/3 of people will have diabetes, a disease that's partially attributed to obesity if people are obese, by the year 2050. All these things are a product of stagnation of salaries, causing people, either adults or parents and their children, to eat increasing amounts of processed food high in fats and sugars, and also increasingly sedentary lifestyles that lack necessary physical education for people to stay healthy. Physicians for a National Health Program is an organization dedicated to reforming the American healthcare system, as well as the Affordable Care Act. They've done extensive research about the flaws in our system. Our healthcare system in America is a fee-for-service system, where doctors are paid for providing lots of care, but not necessarily quality care. Also, the distribution of healthcare spending in our country is not fair at all. 50% of spending goes to 5% of our population. American hospitals are also extremely dangerous, which is not something you would expect. Over 100,000 people die every year in hospitals as a result of avoidable medical care errors. According to The Guardian, a popular newspaper in England, this statistic is only second to English hospitals, which have about 150,000 deaths per year due to avoidable medical care issues. If these trends in poor health and poor access to healthcare don't improve, it's very hard to believe that our healthcare system or our overall health of our population will be getting any better soon. The second issue is that inadequate health insurance, or just a lack of it altogether, has also inhibited many people from receiving the proper healthcare that they need. The Wharton School of Business at the University of Pennsylvania has collected a breadth of information about the issues associated with the Affordable Care Act, also known as Obamacare. The Act's enabled over 20 million Americans to get insured, and this has dropped the uninsured rate to about 8%. However, this coverage is often faulty due to rising premiums and deductibles. These are attributed to more and more insurance companies leaving the ACA market because they can't make a good profit. Also, because of these increasing deductibles due to the lack of competition between insurance companies, more and more people just cannot pay them, so they avoid going to the doctor. Many of these costs are so expensive, in fact, that some people are choosing to pay the fines imposed by the Act for not getting insurance because they're increasingly less than getting insurance. If this doesn't prove our healthcare system and the Act as a whole is fundamentally flawed, I don't think anything will. Also, pharmaceutical companies are constantly increasing the prices of their prescription drugs, and many are offering no cost-effective generic alternatives. Most insurance plans are not adjusting for these increases in terms of monetary coverage, and if they are, many people cannot pay them because they increase their rates as well. If Americans can't get the medicine they need, it's extremely hard for them to recover from their illnesses and then have more positive health outcomes in the future. The third and final issue is the issue of solving the problems that the Affordable Care Act and our overall healthcare system has. To correct this flawed system, I believe that we should use more successful healthcare plans that are present in European and Asian nations as a model. While these systems as a whole would not be able to be implemented, positive characteristics that could be implemented here should be implemented. In my Public Health 102 class last semester, we watched a documentary called Sick Around the World, which compared the US healthcare system to that of 5 countries: Great Britain, Japan, Germany, Taiwan, and Switzerland. While we don't have enough time to discuss the positive qualities of each system, I'd like to focus on 2 qualities in particular, one in Taiwan and one in Switzerland. In Taiwan, there's no gatekeepers or primary care doctors that must refer patients to specialists before they can receive care. If we got rid of this in America, more and more unnecessary ER visits would be avoided, which would clog hospitals up less and also reduce the cost of healthcare on many Americans who just need to see a specialist. In Switzerland, insurance companies are not allowed to refuse covering people just because they're sick, which before the Affordable Care Act, they were allowed to do, and if they're not in the marketplace, they're still allowed to do it. Prescription drug companies are also not allowed to make ridiculously large profits. In fact, they only make about a third of what prescription drug companies in America do. This is a good thing for the people. To conclude, our healthcare system is fundamentally flawed, and it's caused a reduced amount of access to healthcare for many Americans. Over $10,000 per year is spent on each person in our country, even though 50% of healthcare spending goes to 5% of the population. This is a huge issue as America is continuing to become unhealthier every day, and if the system isn't changed, people can't get adequate healthcare that they need. To fix this system, legislators need to stop allowing insurance and drug companies to make exorbitant profits at the expense of the American people who they've sworn to protect, but they're not protecting them at all. For this to be a reality, we should implement successful parts of healthcare systems from the other side of the world. When it comes to healthcare, to put it bluntly, most people don't get it in more ways than one.